Good morning. This is Dr. David Zuckerman. I'm going to be doing a training today. It's recorded. If you have any questions, always you can reach me at 856-229-2939. It's my pleasure to help you at any time, and I congratulate you on the Remy laser systems. So the first thing we're going to talk about is setup. I have the laser right here. It's only 4 pounds. Always hold it with this handle, okay? It has a brick, and the power brick right here is right here. This part here goes into the wall. You just plug it right in. Always make sure this is tight. I've had instances where the laser's not turning on because somebody didn't have it all the way in. So make sure it's all the way in, and always place this next to the laser on the table, right next to it. Just in case, never had it happen, but just in case somebody pulls the cord or trips over it, this will come off the table. Another thing that's important is always have it where the laser is on a cart so that the patient cannot, any of your assistants cannot walk between the treatment table and the cart so they don't pull any wires. This is the handpiece right here. The beauty of the Remy is that you can go from therapy to fungus to surgery, and I'll go through all of this. So you want to make sure that there's numbers on the side of this. Make sure that the blue ring is right above the 20. You can see the 20 on there. Make sure this is nice and tight. And I don't recommend adjusting this at all. So I'm not going to teach you how to adjust this at all. It should be on 20 and tight. You can tell by the 20, or you can see this out. Now, the first thing we're going to talk about is pain. I'm doing a little thing here. Pain. We're going to go over some examples of this, and we're going to talk about plantar fasciitis, Achilles tendonitis. The Remy, it's very important. You can ask me anything or text me, is it used for this, is it used for that? But always ask yourself this. Is there any pain, is there any inflammation or arthritis? The Remy is indicated for physical therapy. Anything has inflammation or decreased range of motions. Inflammation, post-surgical, including wound. But today we're going to just talk about, not today, we're going to continue to talk about it. We're going to talk about plantar fasciitis. This is the plantar fascia, my hand. You always palpate where it hurts. Typically, it's at the plantar medial insertion. They should go, ouch. Mark it off with an X. You then treat, you start treating it, and there's a program, my program, it's in the proposals, it's pain. You start moving the laser up and down or around. You do the whole area. If this is not moving well, then what you want to do is you want to wipe this off with alcohol to get oil and creams and grease off of this, and make sure this is nice and clean. On each patient, this should be not in front of the patient. This should be cleaned and taken out of a plastic little bag, and you can find one, whatever you want to do. Here it is right here. I'm sorry. It's right here. I like to open this up and put this on the handpiece. Notice how I'm holding this handpiece. Don't hold it way up here. Cover the blue. Hold it like this so you have a nice grip. Hold the foot. So this is called the wow experience. It's very important, the wow experience. You palpate on the area. You start treating it. It's set for 10 minutes, and you start in circles and up and down. After 2 or 3 minutes, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4. How do you know you've got the right dosage? After 2, 3 minutes, palpate it. This is the plantar medial insertion. It should feel better. At the end of the treatment, you should have zero pain. If you don't have zero pain, it means you didn't get the right dosage. It's like an antibiotic. You can have the right antibiotic, the right laser, but you got to have the right dosage, just like an antibiotic. So how do you know you have the right dosage? It's by palpation. Palpation. That's very, very important. The second thing is that halfway through the treatment, start doing range of motion. Have the patient move their foot up and down, up and down, up and down. grab the foot, hold the foot and the laser and push it together. And the last 2 minutes, I want to see you taking this laser. It's called petrissage or massage. Push it deep down like this. There is a training section on the video, on the website, remylaser.com. I want you to look at the information on there. The password is remylaser.com, capital R-E-M-Y, capital L-A-S-E-R. The R is capitalized and the L is capitalized. I have a little outline here, so let me get back here. I should know this by heart by now. Okay, so it's, how do you know? There's a protocol list. Read it. It's for pain. It's twice a week for 3 weeks or once a week for 6 weeks. You can choose either one. But the key to this is very important. Palpation is very important. Now I'm going to give you an example how to explain to the patient. This is a little practice management. Mrs. Jones, we're going to treat this painful area and press on it. Today we're going to get rid of the pain. Get rid of the pain. Remember, you get it by palpation, whether it's the Achilles, whether it's Lisfranc's arteritis, whether it's Halleck's ligament, whether it's the Neuroma, whatever it is, whether it's physical therapy. And then you say to them, we've gotten rid of your pain, but there's 2 parts to this. And the 2 parts are getting rid of the pain, but getting it to heal. It's an average of 6 treatments. And then you can arrange for 6 treatments, twice a week for 3 weeks or once a week for 6 weeks. The beauty of the Remy over physical therapy is painful. It takes up time. It's more cost effective. The patient is going to get immediate relief. So let's go over hallux limitus. That's important. If you have a joint that's painful, even if you've given steroid injections, you start, all the protocols are the same with pain. You go from the end of the toe, follow the extensor all the way up, at least to the midfoot. It's 1, 2, 3, 4. You're in contact. 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4. After that, you do the side where the bunion is. You do the plantar surface, the tibial sesamoid complex. After 2-3 minutes, I want you to distend it and treat the laser as your range of motion. Okay, I'm holding this, it's my hand, so I can't grab it. Grab the joint and start distending it and putting it through a range of motion, manipulating it to break up the adhesions. The beauty of the Remy, which is a dual wave, it's 980, which will give you an analgesic effect, and the 810, which will stimulate biostimulation. The big key treatments are Achilles tendonitis. Remember, pain, inflammation, or arthritis. Also, if there's Aquinas with the plantar fascia, this is the gastrocs, this is the Achilles. You start, you could put, if you have a table, try to put the patient on their belly when you're treating the plantar fasciitis or the Achilles, because I want you to go in and treat the gastrocs, do it for about 5 minutes, go all the way down. And this is sticking a little bit, so I would get the oil off by alcohol, let it dry for 10-15 seconds, and start treating the Achilles, okay? And then you can come around and do it all the way around on the plantar surface and this. This will give you at least 4 or 5 degrees improvement in range of motion. We all know that Aquinas is a pathological deformity. We're talking about soft tissue, not ankylosing Aquinas, where there's a bony deformity in there. Another thing is that show the patient the tightness. Show them how if it's a unilateral condition, compare the left to the right. Okay? Now, you can do neuromas. Okay? A neuroma, always squeeze, if it's on the third interspace, squeeze it, show the patient the pain. You're going to take it and go for you're going to do the whole area from the toes all the way up to the Lisfranc's. You want to get at least 60% of the area where it hurts. Don't go short strokes. Never hold the laser in one spot for 4 seconds. So neuroma, you're going to do the second, the third, the fourth. Do the whole area. Do 5 minutes on the top and 5 minutes on the bottom. Push the foot into the area. Push it. If it's too warm, which it shouldn't be, it means you're stroking it too short. It's 1, 2, 3, 4. 1, 2, 3, 4. You can use it for posterior tibial tendonitis. You use the whole tendon, insertional. You can use it for physical therapy with sprains, strains, fractures. If you have a wound, you don't want to touch the wound. Use it, and you go, if it's a bunion incision, you just go over it. Don't touch it because it hurts with the incision, and just do it for 5-10 minutes. Go from the end of the extensor all the way up. go 360. If anything, if it's too warm, and it rarely is, stretch out this. Go longer strokes, or pick up the speed a little bit. I'd rather go longer strokes. In the beginning, you may have to learn this. If it's too warm, stop it, put your hand on it, and it'll take the heat out. Very rare. If you're having that a lot of where it's too warm, you need to talk to me, because you need to have a little proper retraining. How do you start anything? You turn it on. The thing about the beam, which will come on, I'm going to turn it on. The beam is not the laser. Laser is invisible. I'm going to go, it's 1, 2, 3, 4, enter. I'm into my proposals. I'm pressing pain. When you press OK, it brings it up on the sheet, on the screen. It'll say standby. You press it, and it'll say ready. The beam, as you can see, is out. So you never point the beam at the patient. Okay, always wear your goggles. So it's important that you, if you point it at the patient, it's not going to kill them. But now you have to explain to them what that beam is. The beam is an aiming beam. It does have therapeutic, it is a therapeutic modality, but the two main biostimulation or reactions to the laser is the 980 and the 810. The 810, as it goes the deepest, the 980 has the most analgesic. On the training site, look at the PowerPoint that I've given you. I'm happy to discuss it or perform it with you, but look at the training. The laser is only as good as the doctor and the time you're going to put into it. This is not physical therapy. It's physical medicine. So when you're doing the plantar surface, follow the nerves. Don't go, you can do the bands, but you got the medial and lateral plantar nerve. Follow it. Same thing when you're doing in the Roma. Follow the medial and lateral plantar nerves. Visualize the anatomy. So in a summary is always turn the button on and then do it, and then turn it on when you want to stop it, put it up, take it off and press it. And it's 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, either in circles. Don't hold it in one spot. So again, if you're doing Achilles tendonitis, you do the whole tendon, including the gastrocs, and then you can do circles. Push the tendon, let's say it's into the handpiece. The way you know you're done, and this is the most important thing I want you to take away from this first training, is that you palpate it initially, starting to be after 2-3 minutes, you should get some relief, but in the end, you should get zero relief. If you're not getting zero relief, then do it for 2 minutes more. It's telling me that if you're not getting relief, you're not getting the proper dosage in the area. So that's a good start with the pain. The next training will be on fungus. I hope this was helpful. You can contact me at 856-229-2939 or email me at davidzuckerman, DPM, all one word, @gmail.com. Thank you very much. Have a good day. It's stopped.